My name is Christine Marie George, and I'm a professor at Johns Hopkins. And it's my pleasure to present today on our pilot of the PICHA7 Chlorine Mobile Health and E-Voucher program conducted in the Democratic Republic of the Congo. And this research is a partnership between our group at Johns Hopkins, Catholic University Bukavu, and the DRC Ministry of Health. The research activities are part of our larger Preventative Intervention for Cholera for 7 Days, or PICHA7 research program. We focus on investigating transmission pathways for cholera and other severe diarrheal diseases, and on developing and evaluating targeted WASH interventions for high-risk populations for diarrheal diseases. Our work is conducted in Eastern DRC, and we have ongoing activities in both North and South Kivu. The rationale behind our work is that when a diarrhea patient presents at a health facility for treatment, their household members are at a much higher risk of diarrhea than the general population during the 7-day period after the diarrhea patient is admitted to the healthcare facility. This risk is 100 times higher for cholera. However, despite this high risk, there are very few interventions for this population, with the main focus being on the treatment of the diarrhea patient rather than the household members. This led us to the development of the PICHA7 WASH program, which was designed through 18 months of community-centered formative research. This included semi-structured interviews and a pilot study of 518 participants. This WASH program is healthcare facility initiated, where a health promoter delivers a pictorial WASH module bedside to diarrhea patients and their accompanying household members during the time of treatment. The key behaviors that we focus on are hand washing with soap, water treatment, and safe water storage. A hygiene kit is also provided with a hand washing station and a water vessel with lid and tap. Quarterly home visits are conducted every 3 months by a community health promoter, and community health promoters are embedded in the health care system in our study setting. Finally, to reinforce the behavioral recommendations from the in-person visits, we designed a mobile health program where a doctor at a local hospital named Dr. PICHA sends weekly automated voice and text messages on the key WASH behaviors to diarrhea patient households over a 12-month period. Here we show an example of an interactive voice response message from Dr. PICHA, where she speaks to Mwanza, a mother of a child with diarrhea that came to a hospital for treatment. In this example, participants are asked to explain to Mwanza how to correctly use chlorine tablets by pressing 1 or 2 in response to a question. They receive a reply from Dr. PICHA on whether their answer is correct or wrong, and an explanation on the correct response. We conducted a randomized control trial of the PICHA7 mobile health program from 2021 to 2024. 2,334 participants were randomized to be in one of 2 arms. The first arm received a standard message on oral rehydration solution and a basic WASH message given by the government of the DRC. And the PICHA7 arm received the same standard message in the PICHA7 program. The findings from this randomized control trial were recently published in Clinical Infectious Diseases. We found that delivery of PICHA7 to diarrhea patient households significantly reduced healthcare facility visits for diarrhea, diarrhea prevalence over a 12-month period, stunting for children under 5 years of age at the 12-month follow-up, and consistent with this, we observed sustained increases in WASH behaviors during the 12-month study period. These results suggest that PICHA7 presents a promising approach to reduce diarrhea and improve child growth among diarrhea patient households in the DRC. Our current work focuses on investigating approaches to scale PICHA7 to millions of beneficiaries in the DRC. Our initial PICHA7 program, which I just presented, focused on diarrhea patient households. However, our research in the DRC has shown that individuals residing within 500 meters of a diarrhea patient are at a 12 times higher risk of developing severe diarrhea than the general population. Therefore, broadening the scope of our intervention to include individuals residing around diarrhea patients allows for PICHA7 to serve millions more beneficiaries at high risk of diarrheal diseases. This led us to design, in collaboration with Catholic University Bukavu and the DRC Ministry of Health, the PICHA7 Mobile Health and Chlorine E-Voucher program for individuals living within 500 meters of diarrhea patients. Delivery of this program starts with a diarrhea outbreak in a health area, which is defined as 5 or more diarrhea patients from the same health area being admitted to a healthcare facility in a 24-hour period. When an alert is received of a diarrhea outbreak in a health area through our collaboration with the Ministry of Health, we send the PICHA7 voice and SMS messages to individuals residing within 500 meters of diarrhea patients using location-based push notifications. These mHealth messages are from Dr. PICHA and state that there is a diarrhea outbreak in the phone subscriber's health area, and to protect themselves and their family members, they should treat their water with chlorine tablets. In addition to the voice call that's sent, an SMS message is also sent containing an E-Voucher number for chlorine tablets that can be redeemed at a designated pharmacy free of cost. We piloted this program in Bukavu City in South Kivu province of the DRC among 961 individuals residing in diarrhea outbreak areas, and we found that 54% of phone subscribers redeemed e-vouchers for chlorine tablets at their local pharmacies. Furthermore, when we conducted unannounced spot checks at day 7 after the PICHA7 mHealth messages were sent, we found that 64% of households which redeemed chlorine e-vouchers had stored drinking water with free chlorine greater than 0.2 milligrams per liter, compared to 7% in control households, with this result being statistically significant. These findings suggest that the PICHA7 Mobile Health and Chlorine E-Voucher program was highly effective in increasing water treatment practices. Now I would like to summarize our pilot findings. We observed that delivery of the PICHA7 Mobile Health and Chlorine E-Voucher program had high reach, with the majority of phone subscribers redeeming e-vouchers for chlorine tablets at their local pharmacies. We also observed high uptake, with the majority of households that redeemed e-vouchers treating their stored drinking water with chlorine. These findings suggest that chlorine e-vouchers had high user acceptability and is technologically feasible to implement in the Eastern DRC. Therefore, we would like to recommend to WASH practitioners to consider integrating WASH mobile health messaging and chlorine e-vouchers into their existing programming to increase water treatment during diarrhea outbreaks. I would like to conclude my presentation today by thanking the study participants that participated in our research activities and my colleagues at Catholic University Bukavu, including Dr. Cikomola, Jean-Claude Bisimwa, and President Servana, as well as my colleagues at Johns Hopkins, including Kelly Andreas, and my colleagues at the DRC Ministry of Health, including Dr. Placid Waylo, Justin Bengehya, and Dr. Jean-Claude Kulondwa. On this final slide here, we share our 6 recent publications from our PICHA7 research program, and I would be happy to answer any questions by email. My email is on the top of this page. Thank you.